abbreviations.
Okay. Well, I guess it would make sense because you're only dealing with one body part, really the mouth or the teeth or anything like. So it ain't.
Exactly.
So I guess it ain't too many things you can mix up if you're dealing with just one area.
Exactly.
Okay. So these are examples of do not use abbreviations. You see where MS here can mean morphine sulfate or either magnesium sulfate. So think about if a person needs some magnesium because they having some digestive issues, and you put MS and they give them some morphine. And all they needed was some stuff for the bathroom. And you done gave them some stuff that's gonna knock them out. You know, so you have to be careful with those abbreviations. Like she said, here is QD, meaning every day, and QOD, meaning every other day. So that can be confusing as well. And I also slipped a list in here of anatomy and physiology prefix and suffix list. So we got to the end, and we have it here. So I guess we can go over it as well. Let me grab papers. Okay. So you can just highlight the answers or whoever do it first or whatever. So for bad, difficult, or painful, which one is gonna be?
This.
Okay, there we go. For excessive or increased?
Hyper.
Hyper.
You can't hear?
Hyper. I can now.
Okay, okay. Enlargement.
Mega.
Okay. So, okay, somebody give me an example of mega means large. It don't have to be a medical term. It can be a regular word term, but it has mega in it. Okay, so megaphone is just a big phone. Everybody heard of megaphone before?
Yeah.
Okay, so it's a large phone. Like you speaking in a megaphone. So, you know, so that's why I said these medical terms can also apply to everyday life if you knowing what the root of it is. So pain and suffering. Which one gonna be pain and suffering? Okay. Surgical removal.
Ectomy.
Okay, somebody give me a example of ectomy.
Hysterectomy.
Okay, and what are you removing?
Hold on, the women get the hysterectomy, okay?
Uh-huh.
Oh, okay, or vasectomy.
Right.
What are you removing?
Ovaries? When you get a hysterectomy, you can get a partial hysterectomy, and you can get a total hysterectomy. So if you get a total hysterectomy, you're removing all of your reproductive part, ovaries, uterus, fallopian tubes, everything when you get a total hysterectomy. When you get a partial hysterectomy, you might be just getting your ovaries removed, or you might just get your fallopian tubes removed. So a total hysterectomy is when you remove the uterus and everything in it. So that was a great example, hysterectomy. That was a great example. So, okay, next, abnormal condition. Anybody want to go on an abnormal condition?
What'd you say?
What's the answer for abnormal condition?
Osis.
Osis, okay. Abnormal softening.
Nausea.
Malaise. Oh, Malcia. I'm sorry. I'm thinking about malaise. You were exactly right. MALCIA. You're exactly right. I'm thinking about malaise. Okay, deficient or decreased?
Hypo.
Okay, another example besides hypothermia.
Hypoglycemia.
Okay, and so what's low? If I got hypoglycemia, what's low?
Hold on.
Hypo.
That's good. What's low? If I got hypoglycemia, what's low?
You Your blood sugar?
My blood sugar. There it is. That's why I get the finger stick. There. Now y'all know all these old folks in our family, they be had to check their blood sugar. They got but you know what? We don't say hypoglycemia. We gonna say your blood sugar low or high. You know, it ain't no girl. Look, that's how you know. Look, we so magical. We just create stuff. Blood sugar. You know what I'm saying? It's your hypoglycemia or hyper. We just say blood sugar, and that's what it is. Okay, tissue death. What would that be? What answer is that?
Itis. Is it itis?
No, inflammation is itis. We ain't do that one.
Oh, okay. I'm sorry. Yeah, okay, so inflammation, itis. Yep. We talked about arthritis. So tissue death. What would that be?
Necrosis.
Necrosis. Exactly. When you if you die and they need to get some tissue from you to test it or something like that, they'll call it a necropsy. So you know how all of them kind of have the little same beginning definitions. So visual examination, what would that be? Scopy. Okay, so give me an example of scopy. Okay, so I'm gonna say endoscopy. So like anybody heard of Dr. Bowden? Y'all heard Dr. Bowden?
Mm-hmm.
Okay, so he's an endo doctor, you know, and things like that. So if he's gonna do an endoscopy, he's probably gonna put a tube down and look at your endo system and things like that. So endoscopy is a good one. So rupture, what would that one be?
Rices?
Or you can say, people say rices or rexes, or, you know, it depends on how you ever want to pronounce it.
Rexes.
So abnormal hardening.
Sclerosis.
Okay. Okay, anybody know example of sclerosis? The easy one, everybody come to everybody's mind.
What?
Sclerosis, no bad. Multiple sclerosis.
Yeah.
Now everybody won't say yeah. Everybody, where would
I don't know what I'm thinking about over here.
So multiple sclerosis, of course.
Osteoporosis, though. That's what I'm finna say. Then I had to go back and look at my paper.
No, we ain't talking about no porosis, man. We sclerosis. And so multiple sclerosis, as we said, is abnormal hardening. That's why when people with multiple sclerosis, they can't walk or move or their face is stuck, because it's abnormal hardening of your muscles and things like that. So multiple sclerosis is a good example for that. Abnormal narrowing.
Stenosis.
Yep.
Stenosis.
Mm-hmm. And you will hear people talking a lot about stenosis when it comes to their heart or cardiology and things like that. So flow of discharge.
Yeah.
Okay. Yeah. And I'm sure everybody's had diarrhea before or anything like that. So that's a prime example. So the medical term for high blood pressure would be what?
Hypertension.
So what would be low blood pressure?
Hypotension.
Okay, the term blank means pertaining to birth.
Prenatal.
And you see how that, you know how your terms mean something, like natal means birth and pre means before. So even if you've never saw the word prenatal, if you know your medical terminology, if you see prenatal, you know pre is before and natal is birth. So you'll know, man, it's probably pertaining to before you the birth or something. So, you know, common sense. Pain is classified as a what?
Symptom.
It ain't no sign?
It can be a sign. I was confused on that. It can be a sign or a symptom. Yeah, I was confused on that one, though.
Okay, so a lot of times things can be confusing, but the thing is, a sign is telling you this is what you have. And just because you have pain, I don't know what you have. You see, when usually signs are, this is what you have. A symptom is, this is what you possibly could. So you guys are right. This was the right answer. I just want to play with you right fast. But a pain is classified as a symptom. So everybody was right. So the medical term blank means described as inflammation of the stomach. Gastritis. And that itis helps you to know that it's inflammation. So the formation of pus is called what?
Separation.
Separation. Exactly. A fever is considered to be a what?
Sign.
Okay, there you go. So everybody got it right. So it couldn't be too tricky. Everybody got it right. So those that is week 1 that we got handled down. So anybody have any questions about week 1? Did you feel like you learned anything you didn't, or how do you feel about week 1, everybody?
I'm excited. I don't know if it's just me, but I'm excited.
Okay.
I'm excited.
Yeah. I learned some things.
Yeah. And then I'm gonna share some. Yesterday when I finished my assignment, my son, he was like, "Mom, did?" I'm like, "Exactly." Like even he like rooting for me. Like,
Okay. Well, there it is then. Have anybody started looking over week 2? Or I'm going too fast?
Nah, not yet.
Okay.
I'm looking a little
We'll
bit.
start on tomorrow, on Sunday.
I'm a procrastinator, so.
Okay, so that means you work good under pressure in the last minute.
Mm-hmm.
Okay, so now I'm gonna send you week 3 and 4 assignments this week, and week 3 and 4 is kind of skipped over all over the place, where I feel like kind of what's important, that you're gonna really need to know for the next step, since it's only a 4-week and cramming everything in 4 weeks. So the basic foundation is week 1 and 2. So with everything you're gonna learn in week 1 and 2, that's the basic foundation you're gonna need, period. Whether you go into coding, whether you do billing, whether you do anything else in the healthcare field. So like I said, weeks 3 and 4 is gonna be skipped all over the place. It's not gonna, you see how today we talked about the word root and the root words and the things like that. So week 3 and 4, just so you understand, it's gonna be skipped all over the place to make sure I cover everything you need to know in this short period. So any other questions or anything like that? Nope. Okay. So I will see you guys on next Saturday. It actually did take an hour. I thought maybe it was going to take longer than that. That's why I said to 2 o'clock just in case it did.
Everybody made 100. Everybody made 100 this first round.
I don't know. Everybody didn't. No, everybody didn't make no 100, but everybody did good. And I'm going to tell you what everybody, I'm going to tell you on the questions where you had to look and find the answer is like, they probably was like, I don't know what's going on. You know what I'm saying? I didn't read this. She didn't put this in here. Maybe she made a mistake or something. So I guess I'm going to make a mistake with her too. So I guess that's what that was. But everybody did do
not to
real
make no
good.
mistakes, but I did, when I started doing, I was like, hold on now. She said go in the notes so we can scan it on through. Did my work get sent, or do I need a fax number?
Yeah, I'm sure was like, I hope I'm sending this the right way.
Yeah, however you wanted to, whether you just wanted to, because some people, some people sent it to me like this, where it just got 1, 2, 3, 4 with the answers, and some people filled it out and scanned it to me or whatever. So with it, just as long as I had the answers, and so I can go over, whatever that's best for you. I ain't gonna have no methodical, disciplined method that it has to be on white paper with blue trimming with the number at the bottom. None of that. So as long as you turn it in, it's legible. I can read the answers, or you scanned it or whatever. Just no pictures to my cell phone. I had to just tell people, now we ain't gonna do the pictures to the cell phone. You got to turn it into the email so I can print it out and grade it back and do all that. So I'm glad everybody learned a lot of stuff. Week 1. You feel like it was fulfilling for you. So please, if we have these sessions, or if you read the courses and you feel like it's something that I could incorporate to help, do the class better or the Zoom better, whatever it is, I'm always open to y'all ideas of what can make the class better. So if it's nothing else, I'll see you on next Saturday at the same. Okay, yes.
So will you be sending the assignments back to us, or how will you do that?
Yeah, I'm going to send it back to you with your grade on it. I'm going to send it back to you.
Gotcha.
With your grade on it.
Alrighty.
Okay, well, I will see you guys next Saturday, 12 o'clock. See you, Alexis. Okay.
I don't know what's going on. I was doing Zoom on my iPad. Now it's on my phone. And I am just all over the place. So when you ladies signed up for Zoom, did you just do like this whole shebang, your name, your email, a password? What did you do? Because at first I was just clicking on it and my email and everything will come up. Now I just don't know what it's doing.
I think I created an account, if I'm not mistaken, because it had my name when I just had to put the meeting ID number and everything.
Yeah.
That's
That's what I did at first. Okay, well.
Because at first it had iPad on there for you, but now it just say guest. So you might have just put the meeting number at first and your stuff was already logged in, and when you did it the second time, I don't know, maybe you had an account and you didn't know it or something. I don't know.
I'm always doing something. Okay, that's my
Okay, anybody else? Any more questions before we go?
Everybody have a good
Were
week.
you still gonna send the mass email with everybody email?
Yes, I'm still going to send a mass email for everybody's email. I'll do that. Let me write this here so everybody can have each other's emails. Mass email today. I'll send it as soon as we get off the call. So, okay, so everybody, you know, want to form their own study groups or help or do whatever. Okay, what was you about to say?
I was just gonna say, I have a lot of work in my iPad. Some of it could be beneficial, some
Okay.
may not, but I'll send to everyone. I don't mind.
Okay, yeah.
Okay, I'm all for it.
Right. Even me too. I'm all for it too. You might got some stuff over there that I might possibly need. So I'm pretty sure nobody's gonna mind you sending them some you know, some helpful stuff to the email. So I definitely would love it. So I'm gonna send a mass email with everybody's email on it today, so you'll have everybody's email if you wanna you know, just be nice to all of us and pass that around. Okay, so if not, I will see everybody on next Saturday at 12 o'clock. I might send an email, might not. I'm pretty sure y'all gonna remember because y'all remember this Saturday, huh?
Yes.
Were y'all looking forward to it?
Yes,
I was.
Okay. Well, I will see, and I'm gonna edit this tape and send it to the rest of the people who couldn't attend or whatever the case, and I'll see y'all on next Saturday. If you have any questions in between, shoot me an email or whatever the case, and I'll return your email within 24 hours.
Okay.
Okay. All right. Y'all have a good Saturday, everybody. Kids included too. Look, I heard somebody cheering back there, so kids included. Let me get mine. I'm gonna poke mine in the eye and everything, trying to tell him to go in there. So let me look right. So let me get him.
I told my son I've been doing this and had my head turned. I'm still paying attention though.
Look, let us get back.
My baby sleep.
I was just gonna say, you the only one with the good baby, and she don't have no baby. So I guess me and Alexis, we the only one with the problems this year. We gotta go 10 hour problems.
So this just the second weekend. So let's see how the rest of this go, okay?
Okay, see y'all next week.
All right.
Bye.
Have a good one.
You
Bye-bye.
too. Bye.